Now I'm going to show you how to properly assemble and perform your incentive spirometer. An incentive spirometer is a device used to help the patient properly expand his or her lungs to ensure that they avoid any complications following surgery, such as pneumonia. First, you're going to take the device out of the bag. Next, you're going to take the mouthpiece and apply it to the machine here in the front. Next, I want you to pay attention to two important pieces on this device. First is going to be our goal marker. This will show you where we would like you to have the plunger on your breath in, make it to the top. So we'll have it set for you here. Next, I want you to pay attention to these three chambers. This will show you where your progress is and if you need to take a slower, deep breath in. The goal is to stay in the better or best chamber. Next, to perform this properly, you can either sit straight up and down or standing, whatever is more comfortable for you. Next, I want you to apply your mouth to the mouthpiece and take a purposeful, slow, deep breath in. This can be performed 10 times every hour. Make sure you are doing this at a slow pace and using purposeful, deep breaths in. I will show you one more time.